The rollout of the Johnson & Johnson coronavirus vaccine is due to begin today. The first batch of 80,000 doses arrived at the OR Tambo International Airport last night. An additional 500,000 doses of the Johnson & Johnson vaccine will arrive in the country over the next 4 weeks. For more now, we're joined by Sicina, who is the General Secretary of the Young Nurses Indaba Trade Union. A very good morning to you, Rich. South Africa will later today start vaccinating frontline workers. How are your members feeling about this?
Thank you. Good morning, my leader. Our members, to put it straight, our members are not excited. We are not excited because here we are dealing with a government who has proven beyond a reasonable doubt that they don't care about the healthcare system in South Africa. More especially after we questioned the effectiveness of AstraZeneca, and there was a very quick switch to Johnson & Johnson, and we are told the effectiveness of its or efficacy level is only 57%. The problem is that there is no trust now between healthcare professionals, frontliners, and our government. It's worse when we are told that this vaccine will be rolled out or will be vaccinated in a trial study mode. And the biggest question we are asking is, why are we now used as guinea pigs? Are they using us, frontline workers, to trial the vaccine? Why? Why is that? Why the rush? If it still needs to be trialed, this vaccine. So on the ground, healthcare professionals across the board are not excited.
Do you think government has done enough to educate the public and healthcare workers about the importance of vaccines and vaccinations? What for you would be the alternative?
The alternative for us will be to say, let's not rush the process. Let's not rush the process. The situation, yes, people are getting sick, people have been dying, but the situation is not dire as it has been painted on social media in a way that we can rush the process of vaccination. We were saying, don't rush the process. Let's do things thoroughly. Let's do the thorough research. Let's do proper education, more especially with us. Remember, us as healthcare professionals, nurses and doctors in particular, we can help government in terms of disseminating proper information and dismiss all conspiracy theories that have been doing rounds out there, because majority of people, remember, before we are healthcare professionals, before we are frontliners, we are from the society. We are also affected by the same conspiracy theories that are out there, and the substandard way and mediocre from our government. They threw us into the deep end. They didn't give us proper PPE. We were fighting each other in our facilities. As we speak now, we are still talking about PPE. And then the question is, as soon as we are getting this vaccine, we are going to be told that no, you don't need PPE, regardless of the fact that World Health Organization has put it out there clear to say this vaccine is not here to put an end to the pandemic, but it's part of the measures that have been put out there to try to curb the spread of the virus. So enough time was needed, and it is still needed, more especially as far as health education, more information, more especially with us frontline workers, because just imagine if us frontline workers, nurses and doctors are skeptical about taking the vaccine, what about the general public?
No doubt healthcare workers are at more risk, but I think a lot of people would disagree with you about the situation not being dire and there not being a sense of urgency. How are you working with government to ensure that we find solutions? There's a pandemic at play right now.
Remember, government, like I'm saying, that the trust has been broken, because there are basic things. Our government has failed to provide basic things like proper PPE. We were not supposed to be in the middle of a pandemic. We were not supposed to toy. We are not supposed to abandon our work and demand PPE. They failed to do that. Our infrastructure is still the same infrastructure that was before the pandemic. We are still complaining, even before the pandemic. We were still complaining about gross shortage of staff. We were complaining about gross material resources, lack of material resources. It's still now. We are still complaining about those things. And the government should have used this moment, this pandemic moment, to fix healthcare system. Yes, they were not going to fix it 100% for it to be perfect, like, for example, private healthcare sector, even though even private healthcare sector at the moment is under siege as well. But they failed to do basic things. Now, vaccine, they are parading the vaccine as if it's a magical pill that is here to put an end to the pandemic. Give us proper PPE, employ more nurses, employ more nurses who are sitting at home and unemployed, and we are overworked in our facilities. Build structures. Those are basic things. Don't think that you are going to use a vaccine as your escape to do what you are supposed to do.
Rich, young nurses who you represent are a very important demographic in terms of the future of healthcare. What conversations are you having with your membership? Are they going to be taking the vaccine?
That is why we are of the position that government and everyone else must never think that we are anti-vaccine. Remember, we are healthcare professionals. I'm a nurse myself, a professional nurse who's working in a pediatric department. I'm immunizing and giving vaccine to kids every day. We are not necessarily anti-vaccine, but this one, we are not going to sit down and never question it. So on the ground, I am not representing myself. I'm representing members, not only those who are our members as young nurses in the trade union, but almost everyone on the ground is saying we are not taking the vaccine. So we are sending a message to government to say, don't make a big mistake where we are now going to complain later about wasteful expenditure, because you are going to have a vaccine that is going to be transported to different facilities, but it's going to go there and collect the dust, because the majority of them are saying no. Even those who are undergoing training, the vaccination training as we speak, the majority of them is saying, yes, I'm undergoing the training, vaccination training, but personally, I'm not going to take this vaccine. That is what government needs to pay attention to. It's not only our members, but across the board, people are saying we are not taking this vaccine. Yes, there are those who are going to take it. There are not those who are going to take it, but the overwhelming majority is saying no, Assis.
Yeah. The component that feels that they do not want to take the vaccine, what are their concerns?
Their concerns is that the trust has been ruined. First of all, remember, we questioned the issue of AstraZeneca, where the effectiveness, in as far as the new variant or strain that has been discovered in South Africa. And we questioned that in the beginning. When AstraZeneca was heading to South Africa, we said, what about its effectiveness? Then, boom, the issues of missed expiry dates and all that. With this Johnson & Johnson, they are questioning the issue of clinical trials. Were they comprehensive, those clinical trials? Were they comprehensive in a manner that, what about a person who is going, because when you are taking a vaccine, for example, a flu vaccine, if you already have symptoms, or you have flu, even though you don't have symptoms, but you get a flu vaccine, you are just going to get sick, because already you are in a state where anytime you can be sick. Then the question is, are they going to test everyone to discover, to test if before you get the vaccine, are you not positive already? But we are asymptomatic. What about people who are pregnant? What about people who are over the age of 50? What about people who are on chronic medication, regardless of their age? Those are critical questions. That is why we were saying we are not necessarily anti-vaccine, but we are rejecting this one because the proper and necessary information is not coming. People are sitting on the fence. Why things are like that? Why they don't want to answer those critical questions? Then we are good to go. But they are rushing it to vaccinate the population as if this vaccine is going to put an end to the pandemic. That's the problem on the ground we are getting from members and our fellow colleagues.
So South African scientists have been lauded and praised for doing cutting-edge work in terms of investigations into COVID-19. They've been recognized in parts of the world. Are you engaging with scientists to try and find answers to the questions that you're raising?
Exactly. That's what we decided to do as young nurses in the trade union, because we are not a union that is going to just we are going to be all up in arms and complain without coming up with solutions. We are solution driven. We are trying to help our government to say, because people are on the ground that is disgruntled, demotivated, and they are actually angry, to say you are shoving this vaccine down their throat, but you didn't assent to their cries. So with us engaging scientists in South Africa is to get enough information so that we can be of good help to this to our employer, so that we can be able to send proper information, allay anxiety and all that, and make sure that our people know that government cares, we also cares. But at the moment, things are just not they are just not okay on the ground.
So much for talking to us this morning. He, like I said, represents a very important demographic within the health sector, young nurses. We hope to continue to talk to him as the administration and the rollout of the vaccine continues.